Welcome everyone to the latest installment of CADCA's Research into Action webinar series. I'm Carolina Duth and I'm a member of CADCA's Evaluation and Research team. Can you advance the slide please, Julia? Thanks. For those new to the Research into Action webinar series, the goal and purpose of this particular webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. I'm joined for this installment by Dr. Julia Dilley, who will be discussing the local policy options available to communities regulating marijuana sales. She's the author of the study, Community-Level Policy Responses to State Marijuana Legalization in Washington State, which was published in International Journal of Drug Policy in 2017. If anyone is interested in reading her article, it's publicly available, and the link is available in these slides, which will be distributed after the presentation. And now I'd like to introduce our presenter, Dr. Dilley, in a little more detail. Julia Dilley is a senior research scientist and epidemiologist with Multnomah County Health Department and State of Oregon Public Health Division. For more than 20 years, Dr. Dilley has supported public health systems in Washington, Oregon, Alaska, and New Mexico. Much of her research focuses on public health effects of cannabis, alcohol, and tobacco policies. She is currently the principal investigator for a federally funded research study on public health effects of cannabis legalization in Washington and Oregon, focused on the role of city and county policies and local area cannabis market variation. She also co-chairs a national work group that is developing cannabis surveillance best practices as part of the Council of State and Territorial Epidemiologists. And now I'll turn it over to Dr. Dilley.
Thank you. Well, gosh, I'm happy to be here today talking about some of our research work looking at local level cannabis policies in states that have legalized retail or adult use or non-medical cannabis markets. I want to give a quick shout out to, we've had just lots of support from all of our partners, including surveillance partners through CSTE and multiple states. And then the research, as Carolina mentioned, some of the research here has been supported by the National Institute on Drug Abuse. So today what I'd like to talk with you about is contrasting first some state-level regulatory approaches for legalizing non-medical or adult use cannabis, focusing primarily on a prevention lens. So not every single regulation that has been adopted in states, but specifically those that we think are relevant from a prevention focus. Then second, I'll share some of our findings from local level policy data collection and analysis in 2 legalized states, Washington and a little bit in Oregon. And then last, we can discuss some opportunities for local policy action, so how this information might be useful to you going forward. And I just want to acknowledge off the top that our study's been conducted in the context of states that have legalized non-medical or adult use cannabis, but I think some of what we've done might be useful also in states that have only legalized medical or who have maybe not legalized yet and may or may not be potentially going to do so. So I wanted to start with just acknowledging that state legalization has varied quite a lot by place and time, and then the approach. So the table that you're looking at is sort of like a Gantt chart of how the first states have, the timeline that some of the first states have used to implement their non-medical or retail cannabis legalization. This is split a little bit funny. We have the region 10 states at the top, including Idaho, which has not legalized cannabis to any extent, and then other states below that have legalized are listed alphabetically. What you can see here is that we've got sort of like a Gantt chart by year, and the lighter green indicates the year when a state legalized, either passed an initiative and then potentially also implemented possession allowances. So some states, when you look at this, you'll notice that some states, for example, Alaska, passed a measure in 2014, but then didn't actually legalize possession and use for adults until 2015. And a couple of the states have have had some kind of lag time that way. Other states have implemented almost immediately. Then the dark green boxes show you where the states have opened a retail sales market, and you'll see that a couple have not yet done so, including Washington, D.C., Vermont, and Maine. So what I want you to take away from this is that legalization is, number one, not binary. So as soon as you pass the initiative, that doesn't mean everything's legal all over the place within the state. And then further, how the states have done that has varied. And then subsequent to that, what you can see is that not only the timeline, but also the specific regulations states have applied have resulted in differences in what that market looks like at the state level. So this slide is showing you the cannabis retail outlet licenses per 100,000 population in the 4 first states that legalized. And what you can see is that there's some substantial variation in the numbers for sure, but also the population adjusted number of outlets in the different states. So Oregon of the 4 has the most retailers per capita, and Washington State has the fewest retailers per capita. And this was from fall of 2019. So just a little bit, this has changed just a little bit since then, since we're in early 2020, but the pattern has been consistent for a while. So now I want to look a little bit more in detail at how legalization has played out at the local level in 2 states, Washington and Oregon, which are the focus of our research study. And I just want to point out that Washington's population is not quite, but almost double the population of Oregon, but they are located, nestled together in the upper left corner of the United States. And Carolina, did you want to do the poll in here?
Yes, I just launched a poll, so all right, the poll is going and people are answering it. Great. Please carry on, Dr. Dilley.
Okay, so I should keep going. So while you're thinking about the poll and answering with regard to your state, I just wanted to highlight at the state level between Washington and Oregon, there's some pretty important differences in how they have designed cannabis regulations and sort of how those relate to prevention. And here, so I've got some kind of components of regulatory approaches, and then I've put a check mark where it's sort of maybe more prevention focused, or where there was an intention to be more prevention focused. So, so these are important differences in how the state's legal regulatory frameworks are set up. So in Washington, for example, non-medical home growing is not allowed, whereas in Oregon, you can grow cannabis plants within the home up to a certain limit. Washington has, one of the most important things that Washington's done that's different from all the other states is that they established a cap or a maximum number of retail cannabis outlets that are allowed at the state level, and then in specific geographies, so within specific cities or unincorporated county areas. So that's different. Washington also established more, a longer laundry list of buffers that retail cannabis licenses and stores cannot be located within. So most states, including Oregon, have required a minimum distance from K-12 public schools, but Washington adds a whole bunch of additional sites, including private schools and public transit centers and childcare settings, public parks, and so forth. Washington also, both states regulate advertising placement and content, but Washington's restrictions are relatively stronger than Oregon. Oregon has one of the strongest constitutional protections of free speech, so there was some limitation on what could be, what kinds of restrictions could be applied to advertising in Oregon relative to Washington. Washington's also applied a higher retail sales tax on cannabis products, 37%, in comparison to Oregon's statewide tax is 17%, and then local entities can add another 3% on top of that. So since we know that more expensive products can reduce, especially youth use or overuse from alcohol and tobacco, that's why I have a check mark here for Washington, because that's a relatively stronger prevention approach. And then in contrast, Oregon, as a component of designing the regulations around cannabis, Oregon increased the number of criminal penalties that were available for youth cannabis possession. So here I have a check mark here, but I think that's actually sort of a double-edged sword. I think the intention may be to improve enforcement so that young people who may be having easier access to cannabis in a legal context, increasing enforcement for that, related to that. But on the other hand, that can also be very negative and have a detrimental effect on young people who are who might be be penalized for criminal possession and use. But then lastly, both of these states allow local authority to ban sales and apply some other restrictions. And so that's what we'll talk a little bit more about going forward. Carolina, did you want to share the results of the poll, the state poll?
Sure. And I just launched another poll about marijuana ordinances. So please go ahead and start that. Trying to figure out how I can see the other poll. It seemed like a lot of people were from states that had legalized both just general adult use and medical use.
So I'll keep going.
Yeah, circle back.
Okay, so as you all are looking, so the poll is about, and this will particularly apply in communities where the state has legalized cannabis. So the poll is about whether your community has established any particular local regulations around that. So I wanted to start off by sharing these maps with you. So these are maps of Washington on the top and then Oregon on the bottom. And similar to the density of retail stores that I showed you for states a few slides ago, this is a similar thing looking at counties within Washington and Oregon. And so the darker the county, the greater the number of retailers per capita within that county. And so what I wanted you to see over time is that, first of all, Washington legalized earlier than Oregon did, so it makes sense that density increased in Washington earlier than in Oregon. And then because of the way that Washington's, again, had established these retail caps, so you can only license so many retailers per geographic area, Washington's spread or the density doesn't seem to vary quite as much. Whereas in Oregon, there is no restriction of that nature. So in Oregon, you can see that once they started to license, there are some counties that have relatively greater density because there's no limit other than what the market will bear on how many retailers can be licensed within those counties. So let's talk a little bit about what kind of specific regulations those communities have implemented. So this is from our research study. What we did was we collected the municipal policies from Washington and Oregon, all counties, and then all cities with more than 3,000 residents. We've collected those throughout the period of our study and then coded them by month from 2011 to 2017. And some examples of the types of policies that cities and counties had implemented included restrictions on retail sales and licensing and siting, like zoning, defining zones where those licenses could be established and operate. Some communities also implemented complete bans, or they limited the numbers, so established a local level cap on how many could be allowed to operate. Some communities also established an oversight of sales, so by requiring a marijuana-specific business license or their own entity, their city or county general business license. Others applied time, place, and manner restrictions, so they designed additional buffers from specific sites or hours of operation, or put restrictions on things like home delivery. And then a few implemented public messaging requirements within their city or county, so applying to whatever extent they thought they could additional restrictions on promotion and advertising of cannabis businesses, or on the flip side, we were interested in requirements for education about risks and laws. So a community could in theory, also require that retailers provide like links to local substance dependence resources or something of that nature. And then last, local prices, or local taxes rather, which only applied in Oregon because that's preempted in Washington. We used a code book to look at these policies and then systematically code them by month. We've had to adapt our code book over time because both state level policies have changed, and sometimes the local authority to do something different than the state has changed, or there's been new interpretation of what was possible for locals to do. And then finally, the newest part of our study, this is not included in the publication that Caroline will share, but we linked with population information to look at what types of communities had implemented different types of local regulations. And so I wanted to share with you a couple of resources for examples of local policies. So it's very important that local level policies be relevant to the context of the state. So they might look a little bit different, but if you wanted to look at some examples of real policies or models for policies, the top link here is to the Washington State Municipal Research Services Center, MRSC, and they have copies of actual local policies that you can look at right away. So, and I listed here some of the different policy groups of examples that they have. And then secondly, the California's Public Health Institute has a project called Getting It Right from the Start, led by Lynn Silver, and they have a model local ordinance, which was designed for California, but I think the elements of it would be very relevant in any state. But again, you might have to adapt depending on the state context, what's allowed locally. Yes, so it's sort of more of a getting it right from the start as a starting spot, rather than providing you an exact copy of what you'd need. So here are some results from the first wave of our study. This is where we had collected the policies from Washington State. These policies were in place as of June 2016, which was 2 years after the retail market opened within the state. And these two tables are, if I had longer slides, this table would be a long one rather than two wide ones. So it's broken up into two sections, but it's sort of, think of it as a long table. So for example, first I'm showing you the number of cities and the number of counties where there was no policy in place at all at this time in June 2016, and then the percentage of the state that was covered by those cities and counties that had no policy in place. So the percent of the state population, the percent of people within the state covered by that. So relatively few cities and counties, and then definitely few people in the state population were not covered by some sort of local policy. And having no policy in a community essentially means that they've defaulted to the state level policy. It doesn't mean that there's no regulations at all. It just means that they haven't done anything different than what's already on the books at the state level. At this initial wave, 57 cities and 10 counties had acted to ban retail cannabis businesses at that time. So 30% of the state population, even though it was legal statewide, 30% of the state population was living in a city or county where a local regulation prohibited having a retail cannabis store within that area. But more people, 64 cities and 19 counties, were living in places where the city or county had acted to design zoning restrictions. So in other words, saying retail cannabis businesses can operate here, but they can only operate in zones that are dedicated to, say, light industrial, or they can't, the state laws have generally prohibited citing these businesses in residential locations, but there's been differences about mixed residential and business zones. So this doesn't speak to what the quality of those zoning restrictions was, but just that the local entities had done something to say, well, these businesses can only be located in these kinds of different zones. A few cities, 10, had established caps. So even though the state had established caps already on the number of licensees that could be awarded in cities and counties, some of the locals acted to do more than that. So they could further restrict the number, or they could just they could put local laws on the books to fix what the maximum was going to be in case the state changed it later. A small handful created local marijuana business licenses for oversight, and then a greater number of cities, but no counties for either of these, implemented some sort of business license. So that gives the city, in this case, some authority to provide oversight for the operation of that business. And then, of course, they generate fees also, which support the oversight that's provided. At this time, early after the opening, no local entity had increased the A buffer. So Washington State divided their buffer requirements into two sets. The A buffers were sort of, you couldn't get any looser than on these A buffers. So K-12 schools and playgrounds were fixed. But the B buffers were sort of more flexible potentially. And in fact, partway through, I think at the time of this assessment, local entities were allowed to relax some of these buffers if, oh yeah, here we've got reduce the B buffers. So in some urban areas, there are so many of these different kinds of places like recreation centers and childcare and parks and public transit that if you applied all of them and then applied the buffers on top of them, in some urban dense areas that left nowhere that retailers could be licensed to operate. So some of cities and counties were given the option to be able to reduce the distance on some of these B buffers to a smaller distance than what had been described by the state. A decent number of cities and counties added buffers. So they added things like requiring a buffer from a substance dependence treatment site. Some added City Hall as a place where cannabis retailers couldn't be sited near. So they added something that was relevant to them locally, where they didn't want to see businesses cited. 14 cities and 1 county restricted the hours beyond what the restriction was at the state level, the hours of operation that were allowed for these retailers. A few banned home delivery, even though that's not prohibited in Washington, or it is prohibited in Washington state, but a few acted to prohibit it locally as well, which may provide protection in case later the state changes what the law is around that. A few restricted advertising, but nobody required additional risk messages or sort of health-focused messages to be required in retail.
If I could jump in quickly, there were a couple of questions specifically about things on this slide, so maybe it would be best to just answer them quickly.
You bet. Okay.
So from Kelsey, she just wanted to know what the distance is of the buffer for the A buffers from schools.
Mm-hmm. I believe it's 1,000 feet.
Okay. And then Allison asks, seems like 32 cities and only 15% of the state population is covered with business licenses. And does this imply that these are cities with small populations?
Mm-hmm. So 2 thoughts. Yes, I think that it's in order to apply a general business license, sort of relates to whether the city already had a process in place to provide business licenses or to require business licenses for businesses. So I think you're spot on that some of this relates to sort of how big cities are and how much infrastructure they already had in place to create a license. Because if a city didn't have any current process in place to do business licenses, they probably wouldn't build that entirely just for marijuana or cannabis retailers.
All right, thanks. Please carry on.
Thank you. Okay, great. Did you want to share the results of the poll at all, or do we do it at the end?
Sure, we can do that right now. So for the first question, has your state legalized marijuana? We have 43% of the participants that voted, about 2/3, I guess, of participants voted. So 43% live in a state that is legalized for both medical and recreational use. 36% are in a state that has legalized only for medical use. And then we have 21% who are from states that have not legalized marijuana yet. And the second poll, again, a similar amount of people responded, and the largest percent was 37% of people are from states that did not legalize marijuana, so they have not enacted any policies. There were 15% that were in states that had legalized marijuana that haven't enacted any policies as well. And then there were 29% that did multiple policies, and then less than 10% for each of the policies listed: ban on marijuana sales, zoning restrictions for marijuana retail outlets, licensing requirements, and limiting hours of sale.
Great, thank you. Well, we got a nice distribution of people representing different policy environments then. So thank you for sharing that. So I just told you about sort of our baseline 2 years after retail sales started in Washington state. So now I'm going to show you what happened over the course of a year. So between June 2016 and July 2017, what this looked like for for a single set of policies. So here I'm looking at bans, so either a permanent or a temporary ban, zoning restrictions, or having no policy. So I selected these because they're mutually exclusive. So in any community, maybe they're banned retail sales, or they've maybe applied some zoning restrictions to retail sales, so they're allowing, but with restrictions, or no policy, meaning again that they've defaulted to the state policy. So retailers can operate under the regulations as described by the state. So the data under June 2016 show you the exact same thing you saw in the prior slide about number of cities and counties that had applied different sets of policies. So again, 30% of the state, people in the state still living in areas that had banned retail sales as of 2 years after the start of retail sales. But then by July 2017, so looking further to the right, the 3 columns at the right, you can see that some cities and counties had relaxed their policies, so that by July 2017, only 22% of the state population was living in a city or county that had banned sales. Now, some of that was related to the bans that were implemented initially. A number of cities and counties applied temporary bans or moratoria. And when you read the policies, they specifically often said that they were sort of reviewing and thinking about what they wanted to do. So the safest course of action was to apply a moratorium or a temporary ban until such time as they felt comfortable either deciding to fully ban retail sales or allow retail sales. So that's typically what happened. For zoning restrictions, you can see that the number of those increased, so that by July 2017, we had more cities and counties applying zoning restrictions, and about 74% of the state's population living in places where there were zoning restrictions or zoning requirements defined. And then about the same percentage of people living in areas with no policy. And the numbers changed a little bit, but for the most part, you'll see that the populations are smaller in these areas that haven't implemented any kinds of policies. But there were a few that added and a few that subtracted, that kind of washed out to about 4% of people living in areas with no local policy. So now let's look at Washington versus Oregon, and these are both for July 2017. So at this time, the Washington market had been open for about 3 years, and the Oregon market had been open for about 1.5 years from early retail sales, and about, let's see, not very long really. The full retail market in Oregon opened in fall of 2016, so pretty early on in the Oregon retail market. So at this time, Oregon looks kind of similar, really, in that about 17% of the state population was living in communities with a ban, a complete ban, either partial or either permanent or temporary. And again, about 73% compared to 74% in Washington of people were living in cities or counties where there was some sort of zoning restriction defined. And then there were more people in Oregon relatively living in areas where there was no local policy defined. I also wanted to compare for you the percentage in Washington versus Oregon of cities and counties that had applied these local type licenses, so marijuana licenses, general licenses, or no license. And then here on the bottom, I have the percent, again, that had banned sales, so it doesn't really apply, whether they don't have a license because they don't allow that type of business. So here we have about 26% of the state of Oregon was covered by a place with a marijuana specific business license. I think that's a pretty large percentage, in part driven by some of the bigger cities that applied marijuana-specific business licenses, and most especially the city of Portland. And then relatively fewer in Oregon applied a general business license. Another limitation I want to say is that as we were reviewing whether there was a general business license provided, it's possible that some of these cities and counties do have some sort of provision for general business licenses that would be required, but that wasn't specified in their marijuana policy. So yes, it's possible that that wasn't listed. So it's possible that we're undercounting the number of communities that require a general business license because it just wasn't, it's sort of like a basic operating procedure, so they didn't define it in the policy. So that tells you about the number of communities that have regulated, but the next question is which types of communities have regulated, and so that's been the most recent part of our study. So we we took that ban, zoning, and no policy because those are three mutually exclusive policy scenarios. We looked at that for Washington and Oregon separately because the state context is pretty different. And then we said, okay, so for communities that apply to ban, what do they look like? Versus communities that applied zoning restrictions, what do they look like? Versus communities that just default to the state policy, what do they look like? So here we're contrasting those by population size first. So in both Washington and Oregon, the entities that had zoning restrictions had larger populations than those with bans. Then we looked at urban and rural community setting, which seemed like it might be interesting. It's probably associated with population density, or population size, the one we just looked at. So rural communities obviously tend to be smaller in population size. So here you're looking at rurality. In this case, the higher the, so RUCA, which is it's a score for rural settingness, goes from 0 to 6. The higher up you go, the more rural the community. So in Washington, entities that had zoning restrictions and entities that had no policy were both more rural than those communities that had bans, which is kind of interesting, maybe not what I would have expected. Whereas in Oregon, entities with zoning restrictions were more urban than those with bans or no policies. So in other words, in Oregon, rural communities were more likely to apply bans or no policy in comparison to more urban communities applying zoning. So what does it mean? And one way to look at what it means or how it can impact community settings is, so let's look at the per capita cannabis retail density by policy type. So you can still have, the way we measured this was by local entity. You can still have, so a ban would always have no density because within the boundaries of the city or county, you didn't have any retailers. So that's why you see not applicable on ban for both Washington and Oregon. So in Washington, this was a non-statistically significant difference, but it sort of looks like there's more retail exposure or greater density in communities that have zoning versus those that have no policy. And that could be related to the urban and rural or population size factors that we saw in the prior slides. In Oregon, again, this was non-significant, but there was less retail exposure in communities with zoning. And another way of looking at it, so that was retail density. So that's like the per capita number of retailers within an area. Now let's talk about the average distance to the nearest retailer by policy. So in other words, on average within a city or within a county, what's the average travel distance people have to get to a retailer? And here, this is the retail number per, the more exposed folks are lower, and the higher the bar here, the more exposure that there is. So Washington people living in areas that had applied zoning had less exposure than areas with where there were bans applied, and that makes sense. Areas with no policy also had there was non-significant, but they're a little further away. They had more exposure though than areas with zoning. But in Oregon, here's what's interesting is that the areas with bans had a much larger distance to get to the nearest retailer. And this could be related to what I'll show you in a moment about sort of the neighborhoods of these communities in Oregon that had established bans. So that tells you a little bit, there's some variation by community type. I appreciate it's kind of complex and not super intuitive, but the takeaway is that there's some associations between what type of community you're talking about and whether they're likely to apply different types of regulations. And some of the important differences are population size, urban and rural setting, and that they differed by state. So we saw kind of opposite effects of in Oregon and Washington, which likely relates to how the state regulations were set up and how much room there was to move at the local level. So now let's talk about, why does it matter? Do these local regulations make a difference? So this is the same map I showed you previously, but what I want you to think about now is that the reason that there's some variation across communities within these two states is because some of these communities did apply some of these regulations. So in Oregon in particular, in the far right image, you can see that there's some areas of white, which is the least retail density or zero retail density per county in some of these areas. So some of these rural areas had established bans, and that was why there weren't any cannabis retailers operating at the time of this assessment. So what's interesting too is because these areas are rural and they're all next to each other, that's why you see this much bigger effect of the retail bans in Oregon in terms of effects on proximity or the distance to the nearest one, because it matters what your neighbors are doing, I guess is the takeaway point. Because if one community has banned retail sales, but you can walk across the street and then it's a different political boundary and they've allowed sales, then you're still pretty close. Whereas in this kind of southeast area of Oregon or eastern area of Oregon, where you have these contiguous communities with bans, that has a much bigger impact on reducing proximity and exposure for folks. So again, we're talking now about why does it matter? What does that mean? So we just looked at density. Not only is the presence of stores important, but the presence of stores also has a relationship with what kinds of messaging people are seeing in communities. So for Oregon specifically, we had added a couple of questions onto state public health surveys about how much advertising for cannabis people were seeing in their communities or their neighborhoods. And early on, after the markets opened in Oregon, about half of adults, 55% of adults, said that they had seen cannabis advertising in the last month in their community. And that was higher, significantly higher among adults in communities with retail stores, which is not like a super surprising conclusion to draw. We did the same thing with youth on the youth survey. So overall in the state, about 72% of 8th graders or 78% of 11th graders said that they had seen cannabis advertising in their community in the past month. I failed to put the percentage specific to communities with retail stores, but that relationship was similar. So kids in communities that have retail stores were also more likely to see advertising than kids that were in communities without retail stores. And then further, this is getting pretty complex, and here again I have a link to the paper that we did on this, but we looked at cannabis use patterns in communities with stores or where stores had opened and compared them to where people were further away from cannabis retailers. And the paper link that you'll see is where we found an association for Washington state, so that cannabis use increased among adults in those living in close proximity to retailers. So in communities where people were living on average less than a mile or less than 0.8 miles from the nearest retailer, current use increased, but more importantly, frequent use increased. So adults using 20 or more days a month increased. And then for adults who lived further away, so 18 or more miles from a retailer on average, there was no increase in current use or in frequent use for those adults. So the neighborhood presence of retailers seems to be having an effect on use, whereas if a retailer opens miles and miles away, that has less effect on adult use. We're in the process of doing this for youth now. I will say that there are similar patterns. It looks a little different. The figure you're looking at shows you the prevalence over time in current youth cannabis use for Washington and Oregon. The solid lines is the prevalence of cannabis use over time among youth in communities where there are retail stores, and the dotted lines are prevalence among youth in communities without retail stores. So the effect is strongest in Oregon. What you'll see there is the prevalence of cannabis use has continued to decline among those youth that are in communities without retail stores, whereas after the opening of Oregon's market, it increased somewhat among youth in communities where retail stores had opened. So all these factors, this exposure to retail makes a difference. So the takeaway message is local policies can affect the presence of retail exposure especially, and that retail exposure does seem to be affecting whether young people and adults who see messages, and it seems to be associated with their behavior. So what have we learned from our study? So as I just said, local policies can make a difference. They can help control any cannabis environments, and then by extension, hopefully protect public health and protect young people from starting to use. So the level to which communities have acted in our study appears to be associated with community setting. So as we talked about, whether communities were more urban and rural, how big they were, so probably how much capacity they have to take on different types of regulatory structures. The the influence, so how much of a difference their policies make. So especially thinking about retail density or proximity or the distance to the nearest retailer, that is affected by state frameworks. So what kinds of opportunities do local entities have to do something? In some states, it looks a little different there between Oregon and Washington. One big one is taxes in Oregon are allowed, local taxes, whereas in Washington they're not allowed, so there's no opportunity there. That's just one example. Local authority, what are cities and counties authorized to do? That's actually taken quite a while to resolve. In the 2 states, I feel like now it's pretty settled, but for states that are just becoming legal now, it's important to recognize that the understanding what locals have the authority to do can take a while to figure out from a legal perspective. And then neighbors. Again, we just looked at Oregon, and you see that where you have these big areas of all kinds of neighboring entities who have all bans. That has a bigger impact than in the more dense areas where you might be able to control the local policy, but the neighboring policy that's pretty close by is still affecting your community. And then the last thought on these is all these things change over time, not the community setting pieces, but the influential pieces. So, your neighboring entity may change their policy, or the state framework might change, or the determination of what's possible to do at the local level might change. So a few points I just wanted to make in thinking about what is the meaning of all the data and the studies that we've done. So one point I want to make is that tobacco and alcohol and firearms too have been topics that in the prevention field we've been very concerned about for a long time. Sometimes there are limited opportunities for local action because there's strong preemption at the state level. That hasn't been the case as much for cannabis. That industry, at least for now, there has not been as much preemption established at the state level. So compared to those other topical issues that people have worked on, there might be relatively more opportunity to take local action for regulations than there has been. There are other kinds, so our assessment here and what I presented today has been primarily focused on local regulations related to cannabis businesses, but there are other local policies that are also very important from a prevention lens, and that might include how the local revenues are spent. So where communities allow cannabis sales, how do the local funds, the local revenues get distributed, and are those distributed for prevention? I think that's very important. A second thing is enforcement related policies. I mentioned early on that Oregon had done something different with related to youth enforcement. I think that local entities might have a very strong voice in determining whether enforcement of youth possession is an important local law enforcement priority, and then how that's done, whether it's done in a negative punitive action way, or whether instead young people are just provided with resources and support and interventions when, if they're identified as in possession or use. And then a third thing related to specific policies is that normally restricting advertising is kind of off the table due to First Amendment protections, but because cannabis remains federally illegal, there may be some room for additional restrictions, or there may be fewer protections from First Amendment, because if you wanted to argue that the federal First Amendment protections that are offered don't apply because it's federally a banned substance. That hasn't been fully tested, and I'm not a legal scholar, so I can't speak in great detail about that point, but there's some other resources and publications out there that have talked about this. So 2 points I wanted to make. So those were some points about specific policies. In thinking about how to approach policy at the local level, I think there's 2 really important things. One is to consider whatever local policy approach you want to take, to consider that strategically. And by that I mean taking a long-term view. So again, state policies and the local authority to do different things have changed over time, and they could keep changing as we move forward. So for example, public consumption sites, early on in the legalization implementation, that was just not a thing at all. And now it is starting to become a thing. So that's an example of one issue that's coming up, and probably hasn't been addressed in very many local policies because it wasn't addressed at all in state policies. It was just banned completely. So anticipating whatever issues you can at the local level might set up a framework for stronger protections just in case things start to change at the state level. So some examples of that, some local entities had applied interesting policies that seemed like they didn't apply at all, like banning drive-through windows. Those currently aren't allowed at all, but I think some communities were anticipating that could be a thing, so they were banning it preemptively. And the second thing is any policy actions that are being contemplated should really be considered from an equity and a social justice perspective. I think any community that's contemplating some local policies really needs to engage their community stakeholders and get diverse perspectives about what's going to work for our community. So for example, if some potential unintended consequences might be that if you apply zoning restrictions without a lot of thought, it could inadvertently end up citing all the cannabis businesses in low-income community areas. And some of our geospatial analysis have shown that we're seeing more cannabis businesses in low-income areas. So those communities then are more exposed than other types of communities. So that is something to consider. Increasing enforcement actions, especially punitive ones, could disproportionately affect youth of color if there aren't. Again, I'm not at all encouraging punitive enforcement anyway, but if you engage community stakeholders, I think that they would contribute to a discussion about how to, in the event of youth interventions, to apply that in a supportive and respectful and a thoughtful way. And then last, I think it's important to remember that some people, especially potentially lower income people with less health insurance, might be using cannabis for medical purposes and achieving benefit there. So as we apply regulations, you have to have thought for some folks who, and particularly who might have more difficulty traveling to access sites. You need to consider that point of view as well. And then last, so some advice in specific policies, how you approach them, and then what you end up doing. I would really say, and this is my opinion, but the start low, go slow slogan that's often a recommendation for cannabis users is also a good slogan for cannabis regulations. And what I mean by this is that regulations are a lot more difficult to tighten up than they are to loosen from a tight perspective. So one example of this, we saw some communities had enacted those temporary bans or moratoria, and then after evaluating what had happened, they let them expire, or they didn't go on to apply permanent bans. That is way easier than to allow things to allow a licensee to operate and then to try to say later, like, oh, we don't like this. Now we want to ban sales. That would be much more difficult. So again, if you start tighter, you can always loosen up, but it's very difficult to tighten up once the horse is out of the gate, so to speak. And again, I just think we have to keep in mind that the market is continuing to evolve. So it speaks again to wanting to maybe start with a more restrictive perspective, because the markets are evolving, and so starting with a tighter rein on the horse again may help to prevent things from getting out of control if the market continues to expand by offering more products and prices and potency that are becoming potentially of concern from a prevention lens. And then there's some new challenges, of course, to consider. I haven't talked at all about the federal legalization of hemp-derived CBD products, but I'm sure many of you have thought about this, how you can go into pharmacies and on Amazon and buy these CBD products now, and that can be confusing with regard to regulation of cannabis. So I'm not going to talk about that today, but just acknowledging that that's a thing to think about, and it's part of the dynamic environment we're in right now. That is all I have to say. Thank you.
Thank you. So let's move on to the question and answer session. First, CADCA is going to ask Dr. Dilley several questions, and then we'll turn it over to participants to ask their own questions. I already see there's 10 questions in the Q&A box. Keep them coming, please, and put them in the Q&A box, not the chat box. So let's get started. My first question is, I specifically wrote about licensing requirements, but I think this may apply also to restricted hours of sale or banning home delivery. These policies were rarely implemented by localities in Washington and Oregon compared with zoning restrictions and bans. Why do you think these kinds of ordinances were used less frequently than other policies?
So we didn't unfortunately have a chance to talk to people about why they chose different policies that they chose, but I suspect that implementing zoning restrictions is sort of normal operation for municipalities, whereas designing regulations around restricting hours, for example, that's something different than normal. So I would suspect that it's just maybe reflective of what people know how to do. And yeah, so I think that's why you're seeing it less frequently.
All right. So my second question is, you mentioned the possibility of restrictions on advertising for retail and medical marijuana sales. How can community coalitions address marijuana advertising at the local level?
So I want to be really clear that this, to my knowledge, hasn't been legally tested. But I think it's possible that communities could do things like banning billboards, or limiting restriction, or providing more additional restrictions on types of advertising. So for example, in Oregon, we had an awful lot of sign spinners, people with like interesting hats and waving signs on street corners, or mechanized street side advertising, or the noodle men, that kind of thing. So in a state that's allowing that type of promotion, it's possible that locals, for example, could act to restrict those types of advertising specifically. But again, I think it depends a lot on your state's interpretation of advertising restrictions and the law around that.
So to kind of follow up on that, I have a question from Kathy, who's asked, has any of these policies, I think she means in general, not just advertising, such as bans or zoning restrictions or things like that, have any of these policies been contested in state or county court systems?
Mm-hmm. I have to say that we don't have a way of gathering that information. I think it's a great question, though. It makes me, we haven't collected data about that, so I'm not sure.
Yeah, I do think that is a very interesting question. So if a participant has an answer about it, just type it in the chat box somewhere. If someone from Oregon is on this call and knows, or Washington or Colorado.
Mm-hmm.
All right, I'm gonna go back to my questions. There are a lot of good questions in the box and I can't read them all fast enough. Many coalition members and webinar participants reside in states that have not yet legalized marijuana. What steps can you recommend that they can take in the case that their states begin to move toward legalizing retail sales of marijuana?
Mm-hmm. So I think that these kinds of policies, I guess first I would say it depends on your city or county municipality and sort of what their attitude is about preemptive restrictions. But I would say that considering getting models and getting ideas about the types of policies that are available to you, and thinking about what your state is proposing to do, and just being ready to apply the strongest possible prevention policies that your community wants at the local level, and I guess being prepared to have these things on hand, thinking about them ahead of time. Again, I think the start low, go slow. So making the argument that we need to be as restrictive as possible early on, and then, if legalization happens at the state level, like really making any changes apply slowly to communities, so that I just think anytime something is slower, you have just more of a chance to act if something goes awry. So I guess those are my two things: having tools prepared ahead of time for a variety of different policy options, and then making the case that whatever happens needs to happen slowly.
All right, I'm going to start moving to questions from the chat box, or the question and answer box, I should say. We have a question from Dottie. Does the California sample policy template that you mentioned earlier in your slides give details about what policies a school or school system could put into place?
Oh, wow. You know what? I do not remember. I have looked more at it from a municipal policy lens, and I cannot remember if there are model school policies there as well. I apologize.
Yeah, I think I've looked at that sample policy as well, and my recollection is also that it was mostly from a city government standpoint as opposed to a school standpoint.
Mm-hmm. But I really like that you're thinking about other types of policies other than municipal ones. I think school policies is a great area that we need we need better models for. So thank you for that question.
All right, question from Michelle. For those cities and counties that require licenses, how are these funds used? Were they allocated for prevention activities?
That is a wonderful question that we have not assessed in our current study, because we have just been reviewing the policies rather than information about where the funds go. But I think that's a really important point. I think definitely encouraging any locals who are collecting tax revenues to assure that they do go back to prevention or intervention activities, I think is very wise.
A question from Allison. From your experience, what do you notice as main differences between effective or evidence-based policy recommendations or current policies for marijuana versus those in place for tobacco or alcohol? I'm just trying to identify nuance. So that's from Allison.
You know, I think we're still trying to understand what are effective policies. I guess it comes to mind that in tobacco and alcohol policies, you often see sort of a rationale statement that includes a lot of data about why this is a priority for the community, documenting harms or adverse events that the community wants to address with the policy. We have less of that information right now around cannabis because it's so new and regulations are so new as well. So I guess that moving forward, I would hope to see more rationale, including as we document what is effective, rationale for why communities are passing different policies, and I think that will be a good thing. I guess in terms of less effective policy, I've seen some that seem to be kind of not very thought through. I'm sure well-intentioned, but just they hadn't fully considered some of the different types of products, for example. And part of this is just, again, that the market is evolving so quickly. So for example, some policies that were developed maybe early on didn't address dabbing and concentrates and weren't clear about addressing dabbing and concentrates because those just weren't part of the common market at the time, whereas now they're quite common and in the market. So if a community wanted to do something, for example, specifically limiting public promotion of high potency concentrates, that is one example of where that could be a weakness. Yeah. So I guess, having policies that are reactive and relevant to the current status of the market and products is probably an indicator of a higher quality or more effective.
All right, and now we have a question from Erica. What about retail enforcement, such as decoy operations? Have any municipalities had success in reducing youth access with that type of approach? And then I think this is sort of a separate question. Does Oregon allow delivery? California has ruled cities cannot prohibit delivery, but no one is doing enforcement.
Mm-hmm. Oregon has somewhat recently started to allow delivery licenses, and I think we're just starting to look at that. Let's see, I'm trying to find the question so I can. The retail enforcement, I think that's been more implemented by the state regulatory agencies than local, and I don't remember seeing in our policies, I don't remember seeing policies specifically around youth access, like enforcement operations, but I'm thinking that because most of the policies we were looking at were regulating businesses, it's possible that those appear somewhere else, like guiding local law enforcement to do such things and making sure they have the authority to do so. We just might not have been able to capture that.
All right, there's a similar question asking if you know to what extent underage youth are able to obtain cannabis at dispensaries that are lax with carding, but that does not seem to be part of your research. But do you want to comment on it, or should I move on?
So again, some of the state regulatory agencies, so the Washington State Liquor and Cannabis Board, for example, has has a dashboard online, and they post all the results of their undercover operative attempts. And I just looked at it the other day, but the compliance rate was pretty good. I don't remember off the top of my head, but I'm thinking it's like in the 10% violation range. And other states, I think for the most part, have done something like that. Again, it's more state level. Although Alaska is an example of a state that hasn't currently got the authority established for the state regulatory agency to do that kind of thing. So I do wonder if local action to maybe create such a capacity might be a good opportunity.
All right, now I'm gonna quickly jump to a comment. Oh, both of these are from Abby. Okay, so first, Abby has a comment about delivery. She's from Lane County in Oregon, and she said delivery is legal, and they're trying to look into not allowing delivery in specific areas like university, college dorms. Seems like a good policy to be implementing. And then she has a question. Did you encounter any policies around preventing social or public consumption establishments? And she is anticipating the ban on social consumption lounges to be proposed in Oregon and trying to prevent that locally, but would love to know if you have encountered that or if others have encountered that as well.
So I would say I don't think we've seen a lot of local policies that address that. I think because I think all the states started out by saying that wasn't going to be allowed, and it was so clear that local policies just didn't address it. I don't know yet about local. What I have seen is, for example, in Colorado, so in some cases, the state is still saying that there has to be local action in order to allow it. Like there has to be a specific license, and maybe there's a process for locals to protest the license. I guess I would just say that this is all pretty new, and I don't have wonderful examples of local action yet on this topic. But I agree with you. I think it's coming.
All right, we have a question from Pam. She says, I like the idea of requiring retailers to provide information on the harm of marijuana to youth. And she lives in Oregon. How might we do this on the local level at the city level?
So anything like this, I would say check with your local municipality, but it seems like that could be part of a business, like a marijuana business license is requiring, just like you require signage and, maybe locks, or I don't know, there's all kinds of different like fire code requirements that go with a business license, and having information could be part of that. And the OLCC in Oregon does require some kinds of educational messaging. So, it would make sense to try to piggyback on whatever they're already requiring.
Okay, John has a question. In California, the state does not have anyone enforcing regulations regarding retailers. Have you heard of local law enforcement enforcing state regulations? Presumably he means in Oregon or Washington.
I think there has been a lot of local partnerships around with law enforcement, not potentially enforcing sort of conditions of a business operation, but in providing, in assuring security and youth access laws are met. I'm thinking enforcing regulation. I think law. Yeah, it sort of depends on which regulations are being enforced. I don't think I've heard of local law enforcement enforcing business licensing types requirements, although it could have happened, and our study probably isn't designed to pick that up. I'm just thinking about more conversations I've had with folks.
Would it be local law enforcement that would be trying to enforce that business license regulations, or is there some other kind of enforcement agency usually for business licenses?
I'm thinking of business. I guess I'm thinking of business license requirements like fire code provisions, for example. That's usually not a law enforcement issue. That's more like an interaction with the licensing authority, which could be a city. or county.
What I was thinking as well. Okay. So a question from Michael, also about interesting legal issues. So he may not have the answer to it either. He says, we have a number of communities with tribal areas. How has the juxtaposition of these jurisdictions impacted regulations?
So I know mostly about Oregon and Washington, and I won't claim to have complete knowledge about this, but at least as a starting spot, the federally recognized tribes that I'm aware of have defaulted to federal policy until they decided to do something different and negotiate with state governments to do something different. And my limited knowledge is that some tribal communities have stuck with complete bans and the federal policy, and others have moved forward on doing something different, or maybe even engaging in the industry. So I guess in a way it's a lot like other types of neighborhood, or neighboring adjacent policy environments, but the tribal sovereign nations do have kind of a different package and process of regulations that they're considering. I think, again, probably unique for each tribe.
Okay. So a question from Allison. She's from Vermont, and this is currently in her legislature. Likely towns will be able to opt out of marijuana legalization. You still recommend to help towns move forward with local policy enhancements, even though it will take years to figure out what the local authorities can legally do. So I think she's asking, do you think the towns should just go ahead and start banning things or making zoning policies or whatever they want to do ahead of legalization if they know it's coming up in the legislature? And then do you recommend starting with the temporary ban first?
Mm-hmm. So, again, I think it's going to depend on what your community values and sort of where you want to, like how risk tolerant maybe they are. And also whether, I guess I'm not sure whether there could be reasons why communities might not, there might be reasons why communities might not want to do anything until a state law is at least in process. But I think, I don't know, in my mind, the communities that implemented these temporary bans seemed like the policies around those were pretty thoughtful. Like we're just going to say in advance of licensing being allowed in the state, we're just going to say that for a year, we're not doing anything until we figure out what we have authority to do, how it plays out in other communities around us. That seems like a very wise approach in my mind. But it'll just depend. It may depend on how difficult it is to get local policies passed. I guess any of you would know better about your own communities, but if you only have so many political chips, you want to be obviously careful with them.
All right, we have another question from Greg. Are there model ordinances to ban cultivation, manufacturing, and/or sales that can be obtained for use in one's own state? And if so, how would one obtain it?
Mm-hmm. Ordinances on ban. I think that, and I'm actually thinking not of, so some of the bans that have applied to retail have also applied to cultivation and manufacturing. So I think you could look at some of the policies, the actual policies that are on the MRSC site at the link in the slideshow. And I cannot remember whether the Getting It Right from the Start model policies also can include cultivation and processing or manufacturing. But I think those would be good places to start for sure.
And to note, Greg, I'll be distributing the slides after this presentation, and so you'll be able to get those links from the slides. But I think I'll also put the links separately on the website as a resource, so you'll be able to find it on the CADCA website as well. There's another question I wanted to ask here. Where did it go? Oh. Deliza has a question. Has there been any success with policies that set a potency ceiling?
Mm-hmm. I think I just saw one from Alaska that maybe didn't establish a potency ceiling, but banned product types. I have not seen policies that set a potency ceiling yet. I think Illinois, which just legalized recently, is looking at different levels of taxation by potency, and it brings up a lot of issues that potency is difficult to measure. Yeah, the procedures around it and then the testing around it. So I guess I'll just say that. I think that is a policy area that's going to be emerging potentially as the market unfolds, but I haven't really seen it done yet. But I think folks will be contemplating it. And kind of on a relevant point, I see someone pointed out that dabbing and concentrates have been around. Sorry, I didn't mean to say that they weren't invented until the market was open. I agree with what you said here. They just weren't addressed. I think they weren't considered. I think a lot of the early thinking about retail cannabis markets was around flower and maybe edibles. And then it's been more recently that concentrates have become more popular and maybe growing concern from people.
To add about policies related to potency, I think when you tax based on price, you can it'll make it a lot more expensive to get the high potency products, because generally retailers are going to want to charge more for the high potency products. So I think that's one way to sort of limit use on that, but it doesn't directly set a ceiling. All right. Julie has a question. Does your research include surveillance on a tiered model for producers, wholesalers, and retailers, similar to alcohol regulations?
No, we haven't addressed that. It is a really good question, because that's been an important variation in alcohol regulation approaches. And yeah, no, sorry, we haven't. I think we'll need more states on board with variation in that before we can look into it. But it's a great point.
All right, we've done quite a few questions, and I think we're over time. So unfortunately, we won't be able to answer the rest of these. I'm going to wrap up with the last question from CADCA, and then we'll finish the webinar quickly. And the last question is, where can interested coalition members find more information about your work, and what other resources can you recommend for coalitions interested in local regulation of retail marijuana sales?
So I think probably my best resources to recommend are that Getting It Right from the Start website, and then the MRSC website that are in the slideshow. And where can you find out more information about our work? We've had a number of scientific publications or presentations in different settings. I should be better about having a centralized source of those, but what I could do is send you, Carolina, sort of a bibliography of what we've published, and with links to all the stuff that's available online. Why don't I do that after this webinar?
Yeah, that sounds great. All right, let's move to, not the next slide, but the slide following that, about the upcoming webinars. So before we finish up the webinar, I'm going to make a few announcements. The first is that we have a couple webinars scheduled that I want to let you know about. The next webinar in this series will be held on April 16th on the topic of why point of sale matters. And CADCA's Geographic Health Equity Alliance is working with me to provide this webinar on tobacco and e-cigarettes. In another upcoming webinar, Brittany Bugbee will present on her recently published article, Substance Use, Academic Performance, and Academic Engagement among high school seniors, and that'll be on May 12th. So keep an eye out for emails about both of these webinars coming up this spring. Next slide, please. If you'd like a letter of participation for this webinar, for continuing education or for other purposes, please send an email to me at kduth@cadca.org, and I'm going to type that email address in the chat box right now so you can copy it down. If you need a letter, please email me. Please do not put it in the chat box. I will not collect your email address from the chat box. As I mentioned earlier, I will distribute the slides and electronic copies of the articles following this webinar to those who participated. I'll also post the recording of the webinar on the CADCA website and the resources that were mentioned in the question and answer session on the CADCA website in the next week or so. Thank you to Dr. Dilley for the fantastic presentation on your research and your tireless work providing relevant and current material. And thank you to webinar participants for your comments and questions and insights. Hope you all join us for future webinars in April and May.
Thank you.